Hey everybody, this is Dr. Daniel Leonard with Central Ohio Spine and Joint. I'm joined with Courtney, our rehabilitation exercise specialist here. What I want to do today is talk about an exercise that we use pretty frequently in the office here for patients that are dealing with low back pain. Believe it or not, this exercise can actually be used not only for the management of low back pain, but also as a preventative exercise for someone that's looking to try to prevent low back pain. Okay, so when we talk about low back pain usually happens as the result of overload or poor mechanics within the low back and even into the hips, which we're going to talk about today. So what we typically see is over time, with bad posture, with poor mechanics, poor muscle imbalance, is we start to develop a hinge within the low back. That is, when we bend forward or twist and turn, we start to bend more within the low back than we do within the big joints that are supposed to move, like the hips themselves. So come on back up. So what this exercise is called it's called a hip hinge. We're going to try to teach a better pattern of moving more efficiently through the hip joint and not the low back. So what Courtney's going to do here is she's going to place this broomstick on her back, one hand up over top, one hand underneath. You can contact either the back of the head, the mid-back, and the tailbone area. You're going to try to maintain contact this entire time moving through the hip hinge. Okay, so what you're going to think about is creating a hinge at the hip joint as you're bending forward. So Courtney, go ahead and demonstrate for us. Good, and come on back up. So as you can see, she is moving more efficiently through the hip and not through the low back. What happens if she were to do it wrong and move through the low back, go ahead and demonstrate that for me, is you would start to see this pull raise up off of her contact on the tailbone region. So come on back. One more time, do it correctly. Perfect, and come on back up. Okay, great. So this can be used, like I said, either as a preventative exercise and stretch or as a way to help manage low back pain. We use this even in cases of people who have pretty severe back pain, trying to teach them to offload and not overwork the muscles in the joints of the low back. Again, we're trying to move more efficiently through the big joint, which would be the hip joint itself. If you have any questions, please let us know.